We'll run through some snow protocols and what we're implementing, and we want the public to be aware of first. And then if there are questions about the vaccination policies that the city is going to be moving forward on and where we're going to be setting up the pods, I'll defer over to our Director of Health and Human Services, who's leading that effort as we're allocating dollars tonight to set up 6 pods throughout the city. So we are starting we started our preparation for the storm on Tuesday with treating the streets. This is going to be our first time doing this at this scale in close to 2 years. Last winter was a very light winter. We think we're situated in a good place. We have 75 pieces of equipment that are actively working or ready to engage. And we have 6,500 tons of rock salt ready to deploy at 4 depots throughout the city. We've expanded it from 2 depots a couple of years ago to 4 depots so we can get the routes covered quicker and refills quicker. So we think we're in a good situation on that front. We are asking for cooperation from the public with regards to moving their vehicles off the major routes and of course, not using the streets if not essentially necessary. I'm going to invite up our Director of OEM and our Director of Public Works today, Greg KIERCE, and then I'm going to turn it over to Jeff Dublin, who is one of the people leading the effort inside from the command room on the snow deployation, and Frank Lamprello. Okay? So, Greg.
Thank you, Mayor. Good morning. As the mayor said, we've been planning for this event since Tuesday. We brined all of our main roadways and our hilly areas yesterday. At the height of the storm, we'll have approximately 75 to 80 pieces of equipment on the roads. Obviously, we've been following the forecast, and they varied where initially this was coming in, where it was predicted close to 2 feet of snow. It seems to be in that 4 to 8 inches now, but these storms take a change, as we all know. We're prepared to deal with the heavy amounts should it occur. Moving forward, I think what we have to reinforce is the cooperation of the public, which is critical. Not parking close to intersections so our trucks can make the turns. You see we have some of the snow type equipment behind us here, very large, and it takes quite a bit of maneuvering to get them around roadways when people are parked at intersections. The other thing, too, that we encounter a lot is that when the trucks do clear a roadway, folks throw snow out into the street, pulling cars out and things like that. So we're asking for cooperation with that also. But we're prepared. We'll be here until the snow is out of the area, which they're saying is going to be midday tomorrow. Like everything else, we're prepared to move forward and get the city operational and keep it operational. Thank you.
Any questions on any of that? Okay, so that's where we stand today. We're just going to ask the public to make sure that they are mindful of all of the requests from OEM, and we're activating the command center at noon today, so in a half hour. If there's any specific questions, please let us know. Otherwise, thanks for coming out, and if there's anything regarding the vaccination, Dr. Flanagan can handle that as well. Stacey, you want to come up? Go ahead. John, you want?
Yeah, sure. So we have 4 confirmed. Obviously, we'll kick it off at the Bethune Center, which is, one of our neighborhoods that has been the hardest hit by COVID. Then other city buildings, the Joseph Connor Center up in the Heights. We've got 2 of our schools confirmed, Ferris High School and Franklin Williams School. We're waiting for approvals from public buildings that are not city-run in other parts of the city. So we're just in talks, and we're also in talks with the hospitals to add locations. These 6 would be city-run, and then there'll be additional hospital locations and federally qualified health clinics that we're working on closed pods.
Let me just add one thing. Let me just say that we're taking this approach, John, similar to what we did on the testing sites. There was really a lack of clarity from the state and federal government on how dollars would be allocated, what would be reimbursed, and how they expected us to stand up testing sites. So what we made the decision at the time, earlier in the pandemic, was to front the money, set up our own municipal testing sites, and then subsequently have conversations with the state and the federal government about reimbursement and chase those dollars that way. And we did it to ensure that our residents had the best access to testing sites and early. And so we're seeing the same situation manifest itself with vaccination around a lack of information around what type of dollars we're going to have for education, what the expectation is on testing sites, how they're going to be paid for. And so we're going to allocate, or ask the council to allocate, $2 million tonight at the city council meeting. It'll contract out with 2 firms to set up 6 pods throughout the city. It'll help us with education. It'll help us with awareness, and hopefully ultimately reach the goal of 70% of the city being vaccinated in a 6-month time period.
I can't hear you. Oh, so based on the number of cases and our population, the state still has not given us an allocation of doses, but there is an expectation over time to vaccinate 70% of the adult population, although we are still waiting for our allocation. We just need to get everything set up and ready to go, because once we get our allocation, we have 24 hours to start vaccinations. Obviously, vaccinations started yesterday in the state. Our 2 city hospitals are expecting vaccinations later this week and early next week for healthcare workers. We expect nursing homes and nursing home staff to be vaccinated first, and then we go down a tiered list. And so there's about a significant number of healthcare workers in Jersey City that would be first on the list. And after all different types of healthcare workers are the first responders, then seniors and people at high risk, and then the general public. So we expect a tiered plan month to month, adding those additional phases in as we grow each pod. So because we don't, like I just said, we don't have the actual numbers of actual vaccines that we will be getting or being allocated from the state. Not until we know that we're getting X number will we actually issue out a call-in number for those vaccination appointments. These vaccinations will take longer than a flu shot. It takes longer than a COVID test because we need medical support at the location to ensure that someone doesn't have a reaction. And so this will be a little bit more detail-oriented process with a lot more backup and then follow-up, because these individuals will have to come back depending on the vaccines that we get and which time we get them, 21 or 28 days to get their second booster.
Thank you all, and we'll be in touch.